Now we're going to talk about the Maxi Light. It's a machine that's used for getting people out of the car in the emergency department. The Maxi Light requires 2 caregivers. It goes up to 350 pounds. It is battery operated. To take the battery off, you push the red button in, and then to put the battery back in, you push it back in and listen for the clip of the red button, okay? Always check to make sure that your battery is good, and the way you do that is you're gonna push the green button, and then you're gonna push any button on your handheld or column, and you're gonna watch this, and you're gonna watch it scroll through the colors. You want it to stop on the green all the way to the right, okay? This lever is to open and close the legs, okay? You open and close the legs not for stability, but to get around things. These are the brakes. You push them down, and on that side, push it down. You don't use the brakes when you're operating the machine with a patient in it. Use it only for parking. However, if you end up on a slope, you may need to use the brakes to keep the machine from rolling. If something happens with your patient and your patient is up in the machine and you need to get them out and either the battery stopped or the machine stopped for whatever reason, you're going to use this lever. This is called the emergency lowering handle. To get your patient out, you're going to lift up on this red piece, and that will slowly lower the patient down. This is the sling that you're going to use with this machine, okay? This paper, it's used for single patient, multiple use. Now, you folks in the ED, when a patient uses one of these, make sure it stays with them because it's going to be used throughout their hospital stay if they're admitted. Couple contraindications with this sling is that if you suspect spinal issues, spinal injuries, you can't use it. If you suspect long bone fractures, you also can't use it. Couple things about the sling. There are stays in it, and those are for head and neck support. Those stays must be in it. We have had patient fall through the top of this because those stays weren't in. You probably won't see this very often because you're getting them fresh from the Pyxis, but if for any reason this sling has been laundered, this black piece will disintegrate, and underneath it will be a red indicator that you shouldn't use it. Notice on this sling that it has blue trim. This blue trim tells me what size it is, and this blue trim is extra large. Now, just in general, the large one with the green trim goes from 5 foot to 6 foot, but also you have to take into consideration on your shorter patients that you don't want to go to a smaller sling if they're really big through the stomach or the shoulders and have a lot of girth. One thing about using this sling for your car transfers, it's always better to air up one size just because it's a little more difficult to get the sling in place with the patient. Lastly, in terms of fitting those are some general guidelines to choose one, but if you need to fit this to your patient, you see that half circle. That half circle is going to be on your shoulder, and your head needs to be inside, and this piece right here ends up about mid-sacrum, mid to low sacrum. Okay? All right. Now let's go outside and demo it in the car.